everybody, so it's Mickey and it is August the 21st. I wanted to do this vlog just to update you on my appointment yesterday with the specialist. So yeah, on Monday, let me backtrack a little bit more further. I was originally supposed to have an appointment with the genetic specialist and get my anatomy scan done next week. Next Tuesday actually. So, when we got the results for the AFT screening, they said, well, let's see if we can move up your appointment with the genetic counselor. So I said, okay. They were able to move it up to yesterday. But they didn't make it clear whether or not it was just that one appointment or the two appointments. So I called on Monday and I asked them, I was like, my husband wants to go if it's, if we're going to have the ultrasound done. And the lady told me, well, you should go ahead and bring your husband because it says in the computer that you are coming in for an ultrasound. And she didn't say anything about the genetic counselor. So I said, okay. Unfortunately that meant that means that my husband's going to have to do some extra duties and stuff because he had to sort of barter to get the day off for next week. So then he had to barter again to try to get the time off for yesterday. Just telling people, will you take my duty on this day and I'll take your duty on this day and blah, 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 So, for the most part, it actually worked out for the other people too. Let's see. We got there yesterday at 2:55-ish. The specialist's door is like right next door to where I go for my midwife and OB appointments. So that works out perfectly, When I got there, I sort of needed to go to the restroom. Like, they had never mentioned anything about having to have a full bladder, anything like that. So I asked the lady at the front desk, I said, do I need to give a urine sample? If not, I need to go to the restroom. And she said, you don't need one, but you need a full bladder, for the ultrasound. I said, okay. She's like, do you really have to go? And I was like, I can wait. So, the genetic counselor was already with somebody at that time, so they said, usually we do it where you see the genetic counselor first and then you get an ultrasound done. But since they're busy and since you're here, we're going to go ahead and take you back for the scan. I said, okay. Excuse me. Okay, sorry. So, we went back and there was a big TV on the wall so I can look at it, straight at it. The lady asked my husband to turn off the phone so we couldn't record. And so he did. He had my phone and then he had his phone. So he had to turn them both off. And she started to do measurements and stuff like that. The baby was pretty squished in there. Whether it was because I needed to go to the restroom or it was just sleeping, I don't know. But I did ask her, I was like, will we be able to find out the gender on this scan? And she said yes. She said, after I'm done doing all my measurements and everything, then we'll go ahead and do that. And she asked me, do you know what this is for? And I said, well, I know I got an abnormal test. And she's like, yeah, she mentioned that spina bifida, that I tested positive for that or something, and I was like, that's not what I remember, but I'm not going to correct somebody, so I was just like, okay, all right, it's like, let's just get this scan over with, So it took over an hour. The baby was laying on its back, and every once in a while you would see like the hands move or maybe the feet wiggle around or something. That was like the cutest thing ever because when my husband sleeps, he actually plays footsie with himself to put himself to sleep. And at one point we saw the feet sort of rub together and he started laughing. And yeah, it was just really cute. And then, you know, it was just very intensive where she was like, looking at all four chambers of the heart, looking at it in different views, cross sections, and all that business. Doing measurements of the brain, measurements of the arms, the bones. She looked at the blood flow pattern of certain things. I think it was like the umbilical cord, the heart, and something else. We saw the stomach and the kidneys, you know, like she went over everything, and that was pretty cool. At the end, like she was having a lot of trouble because she needed to get a picture of the spine. And like I said, the baby was laying on its back. So she was like, I can't get this baby to turn or move. She kept on, like, she had the thing in her hand, and whenever she was trying to get the baby to move, she would do this on my stomach and try to, like, I guess send vibrations or something to make the baby move. And the baby is sort of like me. When I sleep, I'm completely out. You can't budge me. I'm out. I'm gone. So the baby just was like, whatever, you're not moving me. So that was pretty funny. My abdomen actually feels a little sore today. I don't know if it was because of her doing that. She wasn't doing it really, really hard, but still, like, it was a long time and she was pushing. So, it is quite sore today. If you touch it, it sort of feels a little bruised. When she finally finished with all that, like, she actually had me go to my side a few times so she could try to get a better view. Also, the baby decided it was going to be higher up, so it was like right at my belly button whenever she was trying to measure, and she would just get this shadow because she can't do an ultrasound through my belly button. So that was funny too. When everything was done, she tried to get a picture of the gender, and she's like, your baby's legs are wide open, but I can't tell what it is right now because its feet are put together right in front of where I need to be looking. So just our luck, you know, the baby was being shy. So, you know, she had me move to my side again, and she did find the gender, and she was like, oh, you know, she told us what it was. I'm sorry, I'm not going to reveal it in this one. The reason for that is I don't know who all watches these videos, and we have not told my in-laws yet. So the last thing I want them to do is to get this news over the internet. So once I'm able to talk to my in-laws with my husband here, of course, then I'll go ahead and post something, either a picture or, you know, a video to let y'all know. But yeah, we did end up finding the gender out. I looked over at my husband, and he had this big goofy smile on his face, so that was pretty cool. And then she's like, okay, well, I've done what I can. I think she was getting really frustrated because the baby just wouldn't move. So she told me to go ahead and go to the restroom, and the doctor would be in, and he would do some more scanning. So I went to the restroom, and the doctor came in. He's like, I have a student with me. Is it okay if she comes in? I said, yes, that's fine. I don't mind having a student come in and observe, especially since I have a lot of baggage, you know. Who better to learn from than someone with a whole bunch of issues like me? So, you know, he comes in. I have to pull my pants down again, and he starts scanning. He's like, I'm going to scan again, just to look, just to oversee everything moving. And that's when the baby started completely started moving around and stuff. So, that was pretty cool to see. It's like, woke up because I went to the restroom, or maybe because it actually had room to move because, because I finally had not a full bladder. He started asking me about my history. I told him, you know, I've had three prior pregnancies that I lost. I told him the first two were twins. And he seemed really surprised about that. He asked me, what all have I been diagnosed with? I told him PCOS, MTHFR. It's like I have 2 mutations of that. And then the gestational diabetes. So he was like, wow, like he seemed really shocked about everything that I've been through. And then he's like, okay, well, everything looks really good. He said, do you know what the scan was for in the first place? So I'm like, yes and no. I was like, I thought I was just going to talk to the genetics counselor, so I don't really know what's going on. And he said, well, this is just, there's certain things that we can measure for that are indicators for Down syndrome. And he's like, and based on the ultrasound right now, he's like, there's something, I guess, with the base of the neck, might be thicker, and some other things like that. He said, there are no indicators that we are seeing right now. There's only one thing that, of course, we have to have something not right. My placenta is actually partially blocking my cervix right now. He did say that 90% of the time it does move out of the way. We just want to monitor it, because if it's like that during labor, it's not a good thing. So, yeah. I will be going back to him in 3 more weeks and getting another scan done. After that, I went into the office to see the genetic counselor, and she basically reiterated the same thing. She said, these are your numbers, and she said, now that we know what your results of your scan are, you are no longer 1 and 193. Your number is bumped up basically almost to what my age ratio is, which is 1 and 493. So she's like, it's not quite that high, but a little bit higher, or a little bit lower than that. But that also sort of took me out of that higher risk range. So that's really good. She also took down all our family history, which, blood clotting. As far as blood clotting goes, my grandma does have a blood clotting disorder. That was diagnosed more when she was older. Like she can't be on planes or anything. She's on blood thinners. And I know my husband's mom has had past miscarriages. Like she took a lot of family history down, but she said that none of the stuff that we said basically, were things to worry about too much. So that was good. We feel a lot better. We did talk about tests. She talked about the amniocentesis, and she totally understood where we were coming from. She actually took the words out of my mouth before I even said them about, we've come so far and we've waited so long to get to this point, that it's not worth the risk for us. And she basically said that, and I was like, that's exactly where we are. And she's like, I totally understand. She's like, most people who are in your situation, that's how they feel. And then she mentioned an NIPT test. That's a non-invasive, what was it? Non-invasive, I think it's prenatal, test. Basically what they do is they take your blood, just like the other test, like the AFT. They take your blood, and what it is there is some DNA floating around in your bloodstream, because you and the baby are connected. So there might be some of the baby's DNA in your bloodstream running through as well. So they take your blood, they test it for the baby's DNA. Now they have to be able to get enough of the baby's DNA in order to test it. If they are able to, they will test it for trisomy 21, which is the Down syndrome chromosome. And when they do that, they they are able to tell. It's like a 98 or 99 point something % accuracy if the baby has Downs or not. The only issue with this is it's a new test. It's only been going on for about a year, she said, and my insurance may or may not pay for it. She says she's heard mixed reviews. Some people said yes, some people said they had to pay a copay. She said if your insurance does not pay for it, it's about $1,000. My husband and I talked about it. We mulled it over overnight, and we said if the insurance pays for it, then yes, we will go ahead and do it. Gladly. If the insurance does not pay for it, depending on how much they would cover, then we'll talk about it. But if they don't cover it, then we're totally fine. You know, we feel a lot better with the results of the screening. We feel a lot better just, you know, thinking things through. And I think we, you know, like we said, it's termination at this point is just not an option. Termination in general for us is not an option. So, you know, we're pretty much, we're happy. We're done. You know, if the insurance pays for it, then that's great. We'll go ahead and do it. Why not? And that's where we stand right now. So yeah, sorry, it's rambly, but there was a lot of information that came out. I will, oh no, I already used a lot of your time up, but I will flip this over and show you some pictures. All right, bye. So a lot of these pictures came out really blurry, so I'll try to explain them. This is a foot. You can see little toes right here. There's 5 little toes in the foot. Then we have what I like to call a skeletor. It's got the skull, the bridge of the nose, and 2 eyeballs. And then on this side we have, sorry, my dog is snoring. Here we have the side view, so you see spine, head, nose, and mouth. And this will be the last picture I show you because the next one has the gender. This is the arm, a little thumb, and some little fingers right there. If that was the middle finger, I would have been cracking up laughing, but it's not. I think it's the index finger. But yeah, that's it. Alright, I will see y'all later when I do the reveal. Alright, bye.